Pseudo-addiction is a term that refers to behaviors that could be mistaken for true addiction, but are really just signs that you're not experiencing an adequate level of pain control.
All pseudo-addiction means is that you seem to be showing signs of addiction, where, you may have some signs of seeking more and more pain medications, maybe from not the appropriate sources, or calling your physician for more pain medications. And so we think that you may be showing signs of addiction, of behavioral, psychological components of being addicted to these medications. What we really know is that we're not treating your pain effectively, and that we're not giving you enough medication. And so you're acting like you're addicted, but it's really called pseudo-addiction. You're not addicted to the medication. We're just not helping you enough in treating your pain.
It's important, though, to distinguish that which we may confuse as addiction to pseudo-addiction. Pseudo-addiction would be that you're not getting the right amount of medicine, you're not being treated effectively, and you're craving more medicine because you're trying to get pain relief. Once you treat the patient with the right kind of medicine and they start getting better pain relief, those bad behaviors go away. So we probably see more pseudo-addiction than true addiction with patients with chronic pain.
Usually, the healthcare provider can tell from the individual's personal and medical history whether or not addiction could be a factor. Sometimes, though, there may be no clear signs to guide the provider's choice between safety and medical necessity. In situations like that, knowing the difference between real addiction and pseudo-addiction can make you your own best advocate and your healthcare provider's most valuable partner in shaping an effective treatment program that works for you. Unlike pseudo-addiction, chemical coping is a term that describes a very real condition where the person with pain is misusing opioids in an attempt to treat the emotional trauma of chronic pain rather than the pain itself.
Chemical copers is a term that you may hear for individuals that are utilizing certain pain medications. And what a chemical coper is that they're actually taking the medication not for their pain, but some of the feelings that they're experiencing. Many individuals suffering from chronic pain may have feelings that are very unsettling to them, such as fear, anxiety, depression. And so they'll use their pain medications to treat those feelings. And they'll ask, is that a correct way to treat these feelings? And I tell them often that this is not the correct way to treat these feelings. There's many better ways to treat them. And what they should do is just raise these feelings or bring these feelings to the attention of their healthcare provider so they can help them. And the pain medication is really to help treat their pain, not those other emotions. There's very effective ways to treat them with such techniques as one term you hear is cognitive behavioral therapy. And what that is, helping an individual with coping strategies to effectively deal with their chronic pain. Or relaxation techniques are extremely important and can be very helpful to chemical copers.
Chronic pain isn't just physical. There's an emotional component as well. We wouldn't be human if we didn't experience anxiety, depression, and even fear as a natural response to living with chronic pain. Although it's widely used, chemical copers is an ugly, unfortunate term for a condition that's unfortunate, but not at all ugly. Thinking your pain medications can help you calm down or relax isn't a crime, and it's not a sign of addiction. It's just a very ineffective way to try to cope with normal feelings that can be much more easily treated with counseling, relaxation techniques, or other medications that are specifically designed to relieve them. There's never a good reason to self-medicate when your healthcare provider is only a phone call away and happy to help you decide on a safe, effective, and appropriate treatment option.